I have filed a complaint against Professor Derek Burke for having used personal information as relates to my brother's case and the tragedy that was my brother's case in emails to colleagues, which became public knowledge. And I think it's really important that somebody stands up and says, excuse me, that wasn't right and you need to be held accountable.
What lessons do you think the former director of clinical governance and the GHA have learned as a result of the harm that your brother suffered before his death?
I wish I could say they'd learnt a lot, but I know for a fact that they didn't, because they've never really taken the time to explore the case. In my witness statement to the General Medical Council, I talk about how I mentioned to Professor Burke that some of the assumptions he was making were based on erroneous facts, because it is a well-known fact, and perhaps that has changed with COVID, I don't know. I haven't been as close to this current minister as I was to the previous two ministers. I was very, very heavily involved with advocating for patients, and they were very willing to listen to me. As far as I know, they don't take adequate notes. So there was no ability to learn from my brother's case because we never got to the bottom of the facts. And the facts as they were was that, apart from the fact that Mark was, the opportunity to diagnose Mark was missed till it was too late. He then had his leg amputated because doctors at the time missed the opportunity to diagnose a blood clot in his leg when he'd got off a plane, which 4 years later, and having worked with as many families as I've worked with, I now know, and I think most of us know, that if you get off a plane and you have a shooting pain in your leg, there's a chance you might have a deep vein thrombosis. But at the time, nobody thought of it, and they did an X-ray. And it didn't matter how much Mark complained or how much as a family we knocked on doors, nobody listened to us until eventually his leg was amputated, which added to his overall suffering, to my suffering because I was his carer, to his son's suffering when we had to sign for Mark's leg to be amputated, and everything else that happened. It was so unnecessary. When you needed the system, you had to fight the system. And that's what happens to a lot of people.
I mean, it's a very sad picture that you paint, and you know, I'm sure our viewers are sorry that you and listeners are sorry that you and your family went through that, as I'm sure a lot of people at the GHA are. But how can you be confident that they haven't learned lessons?
Well, unfortunately, or fortunately, Gibraltar's a small community. So I know that the doctors involved have never been held accountable. I know that the pathways haven't changed. And if they have, then that was part of my deal with the GHA, which was to say, we don't want money as a family. We want to give back to the community. That was my brother's wishes. But we want an apology. We want to understand the lessons learned. And we want these to be implemented. We've never had that. The first I heard that really Professor Burke agreed with me was in the press in September, when somebody sent me one of those notices, and Gibraltar being a small community, everybody knew they were talking about Mark. That was wrong in itself, because when I was fighting for my brother and I started becoming a patient advocate for other people, there were those in the system and in the senior management of the GHA who called me a grieving sister, as if I was some hysterical woman who just wanted the attention. Nobody wants this kind of attention. It's not pleasant at all and very difficult.
And you said a notice. I believe you're referring to an email or a series of emails sent by Professor Derek Burke to GHA colleagues or former colleagues, in which he listed details of a case which you say is your brother's, and shortcomings in the care provided to him, and those emails entered the public domain.
Yes, exactly that. And I am very sure that that was my brother's case. And if I were to be wrong, then it would be even more sad, because it would mean that two people lost their legs when it was preventable and when they were dying. And that would be even more tragic, if possible.
What's your motivation for sending this complaint to the Medical Council?
Look, my brother passed away, but my motivation is very much to highlight the need, a need that I've been screaming about for the last 4 years. In fact, I remember the interview when my award was opened in my brother's name. I kept saying, we need an independent patient advocacy team that sits outside the GHA. Jonathan, Gibraltar's very polarised lately. We all watch the news. You're either with the government or against them. I am not there. I think there is a lot to applaud this government for, and things we should be criticising this government for, but isn't that what happens in a free society? So I very much want to highlight the fact that if we had had a patient advocacy team, then perhaps ministers wouldn't rely on what they're being fed by senior management in the GHA. I run big sites. If I ask my guys, did you do this? Of course they're going to say no. It's human nature to protect our jobs and our livelihoods. So I don't blame the government or the opposition for all the toing and froing that's happening around this subject. But what's happening is that amongst who's right, we're forgetting what's right. And what is right is that we deserve a health service that protects us. And if it fails us, that it learns from itself. And that we all know it's learned from itself. We don't find out in emails from colleagues to colleagues when you're being told that you're just a grieving sister who's imagining things. That is so, so wrong.
Understandably, you're championing and focusing on your brother's case, but more generally, you've taken on the role of patient advocacy for a number of people who are dealing with health issues and with a number of health professionals and trying to navigate that system and the challenges that it presents as best possible, aren't you?
Yes, I am, because I was quite vociferous when Mark got sick, and I was very open in calling out for this patient advocacy, and I would talk to people outside the hospital. I'm that kind of person. Then people started gravitating towards me because there was a gap to be filled. And so over the last 4 years, I've been involved with a lady, for example, who had stage 3 oral cancer, and she was told for months that she had thrush in her tongue until she almost died from it. Or a very close friend of mine who's recently been in the press, and I have her permission to talk about it. She's been very brave. She's been photographed with her scars, but it took 7 months before someone listened to her. Now, if all these mistakes were really learned from, and these people were, interrogated, so to speak, or investigated, then surely we would have recommendations. So the general practitioner who didn't listen to this lady, perhaps go on a course to learn how to, diagnose breast cancer better. It's not sometimes about punishing doctors. I mean, we're all people. Medicine is certainly not, something that is completely fallible. It can be infallible, and people are infallible. But if we don't learn and get better, then what is the point of all these people suffering? And I could talk to you about a lot more families, but some of them are still on the journey where their loved ones are dying. I could tell you about scans that in the GHA have been read and no tumour detected, and when they've been sent to a tertiary hospital for a second opinion, that consultant has said, but your cancer has spread. You had a tumour there, and your doctor in Gibraltar didn't read the scan properly. I mean, that is crazy. We talk about repatriating services. If we can't do the basic things right, why are we touting repatriating services? So we can do more mistakes? The more service we repatriate, the less we'll have second opinions, the less we'll leave Gibraltar, and the more mistakes there'll be. Nothing of what is coming out makes sense to me at all.
So just to summarise then, you disagree with the fact that you only found out about what he had learned about your brother's case through a series of leaked emails, but you obviously want that learning to take place. You want clinical governance to be rigorous and for lessons to be learned.
Look, I want the most important thing here not to be forgotten, that between the toing and froing that's happening now between the opposition and the government, the fact is that there was an opportunity to be learned, that there were many cases to be learned from, and that isn't happening. And that has to happen. And I thought long and hard about taking this action. It doesn't bring me anything except talking about something which really, really hurts me and makes me very angry. And I probably didn't sleep last night because I was thinking about this. But in the end, if you're in a position of management and you're a doctor in that hospital, you have a really, really, really established and severe duty of care to highlight mistakes and to change things very, very quickly. And the medical director at the time, Dr. Casaglia, sat with my brother and knows all these things. And in the end, people who come to me now for advocacy are still suffering some of the things that Mark suffered. So, for example, needing pain relief, but there only being one GP on duty, and many other things. And so what I really want to do is to make people accountable. If you're doing a job which involves caring for the people of Gibraltar, do it.
What are you hoping this action will achieve?
I'm hoping it will stop the politics, that both sides will stand down, that we stop focusing on the rumours of, why did Professor Burke suddenly go away? There's so many rumours as to that. And we focus on the fact that some of what he said happened. Because some of those cases I recognised, above all my brothers. So if these things happened and they are really being addressed, then talk to the families and make sure you really get the facts, because half of those records don't reflect the truth. I remember that one of the things Professor Burke came back to us on, and it's in my witness statement, that my brother hadn't turned up for doctor's appointments. That's absolutely not true. There are ministers, and even Dr. Casaglia himself saw the letters that Mark wrote asking for appointments, asking for checkups, and the system never listened. So a lot of what, is perhaps being investigated is based on facts that are erroneous in the first place, because those records aren't right. Through my meetings with Dr. Burke, and it's mentioned in my statement, he refers to appointments Mark missed, blood tests, doctors missed appointments, other things that I know weren't true because I've got my brother's diary. My brother was sometimes very annoying guy, but he was very methodical. So I have a lot of evidence that proves Mark's journey, and it makes me very sad.
So you're hoping that your action will contribute towards the GHA learning more from its mistakes?
I'm hoping that my action will make everybody realise that people that are calling for a separate patient advocacy team are right. I know of people who haven't had closure for 10 years. It simply isn't right. We have all sorts of committees in GEB and all sorts of steering committees and all these things. It's not difficult to set something up. And given the amount of negligence, which was highlighted by some of those cases, surely be a good use of money to learn for where you've gone wrong rather than keep settling claims.